have to ask ourselves if we can call ourselves the greatest nation in the world, while 70%, nearly 3 out of 4 adults, are overweight or obese, while we spend about 18% of our GDP on healthcare, more than any other nation, and yet we rank 55th in life expectancy. Our children are getting type 2 diabetes at unheard of rates. This is not just a health crisis, it is a cultural crisis. Obesity is not inevitable. It is not an act of God. It is something that can be prevented. It is a choice that has been compounded by bad habits over time. It is reinforced by a culture that does not foster good decision-making and self-discipline. And we have created a culture where these difficult truths have become personal attacks, where physicians are afraid to talk about a patient's weight because it's too taboo. If we can't have a conversation about obesity, how can we ever solve the obesity crisis? Obesity is associated with 13 different types of cancers. It takes between 3 to 10 years off of life expectancy. It damages DNA, causes double-stranded breaks to DNA, which is the precursor to oncogenic mutations, and it fundamentally accelerates the aging process. And yet it is the principal difference between our nation and the longest-lived nations. We are overfed but undernourished. So about, I would say, 60% of daily total calories consumed by the average American come from ultra-processed foods. These foods are caloric rich, they are nutrient poor, they do not increase satiety, so people do not get satiated, they continue to overeat, they gain weight. They're cheaper than whole foods, so people are economically incentivized to eat unhealthy, and they activate the dopamine reward pathways in our brain, causing addiction. So this trifecta of no satiety, low cost, and addiction really kind of spiral us into this process of poor health outcomes and runaway healthcare costs.